Lovely. Right, so we're nearly there, guys. We're nearly at the barbecue, not long now. So thanks for all sticking around to listen to me. Today I'm going to talk about information, so primary bone cancer information. And I'm going to start off by talking about national priorities for health information, and then kind of talk about how BCRT are involved in different initiatives and what we've been up to as far as providing information goes. And just to define information, what I'm talking about today is information provided to patients and the public. We're not focusing on information to medical professionals or anything today. So, why is health information important? Well, there's a couple of excerpts here from the NHS Constitution in 2009 and from the Department of Health to show you what the kind of national priorities for health information are. So, the NHS Constitution included a commitment to offer easily accessible, reliable and relevant information to enable you to participate fully in your own healthcare decisions and to support you in making your choices. And in the Power of Information report, which came out from the Department of Health in May this year, that's been extended. So the information can bring enormous benefits. It is the lifeblood of good health and well-being and is pivotal to good quality care. Information is regarded as a healthcare and service in its own right for us all, with appropriate support in using information available for those who need it, so that information benefits everyone and helps to reduce inequalities. So strong words and a serious commitment to provide information for people and to respect information as a healthcare service in its own right. So if we have a look at that commitment, break it down and see what's being promised. So the information needs to be easily accessible, reliable and relevant. So I'm going to talk about how the government's been meeting those targets and the different schemes that have been rolled out. So easily accessible information. We need a point of call where everybody can go to get information about different healthcare, different diseases, and yeah. So what the government has done is the NHS Choices Information Prescription System, which was launched in 2009. And this is a centralised web resource which is accessible by the public and also by healthcare professionals. So when you go to the GP or you go and see the nurse, they can print you out a set of information, a prescription of information that's relevant to you at this particular time. Or you can access it from home and look up treatment, choices, outcomes, that kind of thing. So this includes information about health conditions and also contacts for associated organisations. So patients can be given personalised, stage-appropriate information to help them to understand their condition. And I don't know whether any of you have used NHS Choices at all. This is the kind of website you go to if you're looking at bone sarcoma. So as you can see, there's different sections with drop-down menus with different information. So information from the NHS, and then information from charity partners. So, and this is where the BCRT will be getting involved by providing information to be uploaded onto this system. And then local information and directory, so that would be points of contact. So again, BCRT, support organisations, that kind of thing. So we have a centralised, accessible resource. But how do we guarantee reliability of information? So government research showed that 77% of people look up healthcare information on the internet. And 3/4 of those people find it really hard to tell what information is reliable and trustworthy. So the government launched this information standard. You may have seen this logo on BCRT's website and also on different healthcare charities. So the information standard is a certification scheme that helps health and social care professionals and the public identify reliable sources of quality, evidence-based information through the use of an easily recognised quality mark. And this was launched in 2009 with 36 pilot organisations, which included BCRT. And thanks to the work of my predecessor in this job, John Newby, BCRT achieved information standard accreditation in 2010. It's a huge amount of work to do this. And certification is based on a thorough audit and approval of an organisation's information production system. So this is the step-by-step system for how the information is produced. And this is BCRT's information production system. So as you can see, it's not as simple as writing something, sticking it on the website and hoping it's okay. Information is produced by, the information officer, by looking up scientific literature, speaking to patients, speaking to medical professionals. And that first draft of the information goes out to our information advisory panel, or the teenage advisory panel for our teenage booklets. And the information advisory panel includes patients, families, family members, and medical professionals. And they all get a chance to read through the information, give their feedback, and all that feedback comes back to me so that I can put together a second draft of the information. This second draft then goes out again to review to our editorial board, which includes 2 medics and 1 person who is an expert in plain English, the Plain English campaign. So they can approve the information, check its readability, and that it's all correct. And then it goes back to the Research and Information Committee for final sign-off. So does the information standard work as a way of accrediting good information? So uptake's been kind of slow with this. There are around 10% of the information producing organisations in the UK currently have information standard accreditation. But among those are some of the major information producing organisations such as NHS Choices, Patient UK, Macmillan and Cancer Research UK. So now 33% of all health information web traffic is information standard certified, and 90% of the information that's been loaded onto the information prescription service is accredited by the information standard. So it is being respected as a quality mark. So we have accessible information that's reliable. How can we guarantee that it's relevant? So through the information prescription system, specialist organisations can supply the information. So that includes larger organisations like Cancer Research UK, Macmillan, and also smaller organisations like BCRT. And as you all know from the feedback we had in the session earlier, primary bone cancers are rare and patients struggle to find relevant information. So it was clear that what was needed was a more coordinated effort for bone sarcomas to ensure that the information gaps are filled. And so what's happened is that there's a special funding has been granted to the 5 bone cancer centres, which is Oxford, London, Newcastle, Oswestry Street and Birmingham, to create this bone sarcoma information pathway. And there are 3 different phases to that project. So phase 1 was a report on available materials, which kind of reflected the very different information resources available at different bone cancer centres. The second phase is kind of ongoing now, and that's discussion groups with patients at different centres to see what kind of information they need, what's missing, what haven't they been able to find. And phase 3 will be to develop information to repair those deficiencies, so to fill the gaps in the information. And we're going to be involved in that for bone cancers. And there's another information pathway that we're involved in, that's the Children and Young Adults Information Pathway. So a second special commissioning group has been granted for providing this information. And this is currently under construction as well. Also, BCRT are represented on the Children and Young Adults Cancer Information Steering Group, which is a group of charities who provide information for children with cancer, just to ensure quality of information and shared standards. So, what does BCRT want to do with information? What's our information commitment? This is from the BCRT website. BCRT is striving to become the recognised, reliable source of information on bone cancers, in particular osteosarcoma and Ewing sarcoma. User-friendly information can already be found on the website, and this will be increased. And you can submit your own questions and receive replies, but individual cases cannot be dealt with specifically. So what have we achieved to meet those standards? So those of you who've looked on our website, you can see we've already got some really great information about osteosarcoma and Ewing sarcoma. This is currently undergoing its review process, which has to be done as part of the information standard accreditation. And once that information is reviewed, we'll be able to upload it onto the information prescription system so that it's accessible by people through that as well as through our website. We've got our involvement in the sarcoma and children's young adults information pathways. Also, we're increasing our information provision on the website. So we have information on chondrosarcoma, which has been in development for a while. It's written and is now in the final stage. It's at the editorial board stage of the information production system. Chordoma information is going to follow, and then into the rarer cancers as well, spindle cell, giant cell tumour of bone, etc. And also we've got our teenage information booklets, which have been really well received. And these have been requested by hospitals all over the country, from Manchester, Bristol, Birmingham, etc. So how does the BCRT match up to the national standards? So accessibility, well, we've got our website, we're playing a role in the information prescription system, and we've got our booklets that are being sent out to the wards. Reliability, well, we've achieved the information standard accreditation, and we passed our first year surveillance visit a few weeks ago. And relevance, well, we're trying to cover more diseases to make our information more relevant to different people, and also target our information to different age groups. And that's all. So has anybody got any questions?